All right, thank you very much for taking time out of your day, and thanks to Heidi and Christian Sport New Zealand for bringing me down. Might declare that I don't know anything about equestrian sports, okay? Never been on it. No, I'm sorry, that's a lie. May have been on a horse once, but your organisation came to us beginning of the year interested around concussion and my area of interest, and that's all I do is sports-related concussion, and so we work with Christian Sport New Zealand and came up with, I think, a guideline or policy that's now on your website around concussion, which is obviously very, very topical. So I guess the aim of today is to kind of maybe educate a little bit, upskill you a little bit. You can teach me about equestrian stuff, and hopefully I can teach you a little about concussion stuff, so that you are out there officiating and watching, and you're as a sport person, I guess, and so you're going to be invaluable to just trying to pick up these people who unfortunately don't make some good decisions when they have been concussed. So, oops, turn them off first, that's a good idea. So we're going to keep it pretty informal, okay? So just jump in and ask a question whenever you want, and I'll try and, don't worry if there's some technical words, we're going to break that down and not going to be too medically technical at all, because actually I'm a pretty simple person. I'm really really smart, so we're going to keep it pretty simple, okay? And you guys know this. I mean, you play sport, then you get on top of a 600 kilogram beast, and then you want to jump over things, right? And they say rugby's stupid, okay? And so I did a lot of teaching to World Rugby around pitchside care and how to manage trauma on the field, right? And our first part of the introduction is always going to horse riding and saying, listen, you think we've got it bad, look at these guys. So unfortunately, these things happen. We don't mean it to happen. Sometimes it's that person's fault, and sometimes it's this animal's fault, and sometimes it's someone else's fault, but it just happens, and they're called accidents. But you have, again, a big animal and a height, and you want to jump even higher. So all those things, unfortunately, when you fall off, means potentially there's a little bit more risk. And you don't have to Google pretty hard to find out that, again, unfortunately, there are a lot of injuries. But the good thing is, though, that they are decreasing, right, which is a good thing. And it mainly affects these parts here. So, we're interested in the brain, okay? We're interested in this part here. And if you look, like I say, sometimes it's that person's fault, and sometimes it's this animal's fault, and sometimes it's someone else's fault. But about 30% of this study, and it's an Australian study, so it's probably applicable to kind of New Zealand, will involve the head itself. And if you look at I've actually spent some of the weekend, to my wife's dismay, going through some medical journals and things, which doesn't really excite me that much. And anything from sort of 10 to 15% of injuries, are related to concussion in horse riding. Okay, and I suspect that's low. I suspect that's very low because people don't know it, and we just don't see it. People dismiss it. So I suspect that's extremely low. This probably, I think, presenting to emergency departments in Australia is probably closer to 1 in 3. 1 in 3 people who fall off. And what's the cost? The costs are significant. If you have a traumatic brain injury, so traumatic brain injury is actually when we look and you can see some damage. Okay, that's what it is. And so if there's serious ones, so those ones we scan and you can see something on those, they're about $50,000 per year per case. Right? Whereas the non-serious ones, which is kind of the concussion side of the scale, it's still about $15,000 per case. And those are just the numbers from the ACC data just in the last year from equestrian events. Right? So it's a lot of money. So what is a concussion? Well, don't worry about these big fancy words, but essentially concussion is a transient disturbance of what we call neurological function. So let's break that down. Transient means, what does it mean? It means it comes and goes, doesn't it? Right? Transient things, they get better. And most of these things, if you do the right things, will get better. Right? I was just telling Heidi at lunch that I spend most of my days giving people really simple advice because people want to do really dumb things, right? And so I protect themselves against themselves, right, with some simple advice because it's transient, so it does get better. And it's the disturbance brain function, okay? So not the way the brain looks, it's the way the brain works. And if you want any of these slides, Howdy, I'll send them all to you, so you can all, you can have these if you want to use them at any stage, okay? So it's the way the brain works, not the way the brain looks. Now my analogy to that is, if I come to your house and take a photo, okay, I'm standing outside your house and I take a photo, your house looks lovely, right? A photo tells me about the way the house looks, okay? It's painted, the guttering's intact, roof's done. It does not tell me about what's going on inside the house, okay? So the structural brain problem is what we can see on a scan. And concussion, we don't see it on the scan because it's a disturbance of function. So it's what's going on inside the house. So that is why scanning does not help us. Right? Often a waste of time, and all we do is irradiate people and we're moving away from that. And the other thing is, only 10% of people are knocked out. Now if I go and ask someone how many times they've been concussed, I can guarantee you they're going to tell me the number of times they've been knocked out. Not the number of times they've been concussed. Okay, so 10% of people who have a concussion actually have a loss of consciousness or are knocked out. The other 90% don't. And there's a whole range of symptoms and a whole range of signs that actually you can think of most things, right? And it will be a symptom. I bet you guys can name me some symptoms. Just tell me, there we go. Sorry, you're in the wrong place. Tell me a symptom of concussion. Anything.
Loss of memory.
Loss of memory, there you go.
Blurred vision.
Blurred vision.
Don't know the day.
Don't know the day.
Vomiting.
Vomiting.
Confused.
Confused. Yep. Anyone else? Jump.
Dizzy.
Dizzy.
Headaches.
Headaches. Vague.
Repeating yourself.
Repeating yourself. Yep.
Outbursts of bad language.
Yep. Total disinhibition, isn't it? Exactly right. You lose the filter. Yep. The filter's gone. Irrational. Yep. Tiredness, fatigue, you want to go to sleep, drowsiness. So you all know them, okay? And actually all you have to think about is a drunk person, right? Now, supposing that some of us may have overindulged from time to time in this room and have seen our friends do the same thing, and the way they behave and the way they act and the way they feel is not dissimilar to a concussion. All right, headache, guarantee that if you overindulge, you're going to have one of those. Slurred speech, poor memory, inability to walk straight, right? Falling over, vomiting, depends on how much you've had. Right? So those symptoms, if you can think of those are what a concussion, a person who's concussed is going to have the same symptoms. Okay? The difference between the person who's concussed and the person who uses alcohol is alcohol's done the same thing to the brain. It's changed the way the brain functions, the way the brain works, just like a concussion does. Right? I'm supposing most of your riders don't drink beforehand. Maybe afterwards if they've won something, but generally not beforehand. And it doesn't have to have a hit to the head, okay? It can be an indirect force. So most people think it's got to be a hit to my head to cause a concussion. It doesn't. So in rugby, where I've spent most of my time, someone can have a very perfectly legal tackle, right? And it's the transmission of that forces to the brain which then causes the concussion. It's often that whiplash type thing. So it doesn't have to be a blow to the head. So if you think of your sport, you don't have to fall off onto your head to do that, okay? But forget all that stuff, all right? Because for me, if the person looks and feels terrible and they've done something that potentially could have been a concussive-like event, then I think everyone in the room here, right, that's all you need to look for, right? And sometimes I've kept players off the field and I've known them and they've passed all my testing, but they just don't look right? And they look horrible. You look in their eyes and they look glazed. They just just doing some weird stuff that you're not quite sure of, right? So if they look and feel terrible, somebody falls off their horse, get up, they're kind of acting a bit strange, and they just look bad, you know, then they're probably got a higher chance of having a concussion, right? Now, the beauty of the woodpecker, anyone know the woodpecker, okay? The beauty of the woodpecker is if we're all built like woodpeckers, I wouldn't be standing here because I wouldn't have a job, okay? Well, I might do in sports, but it wouldn't be related to concussion. Woodpeckers beat their heads all day, don't they? That's what they do, right? They're banging their heads constantly. They don't wear a helmet, right? So how the hang does a woodpecker get away with it? Well, it has this tongue that comes up and it wraps around its brain, right? And it insulates its brain, right? But us on a so-called high evolutionary scale, right? Well, we didn't put that feature in. In fact, what we did is we put it in a big, thick box. Well, that's a good thing because the skull actually protects the brain. But then we put it on a stalk, okay? And we let it float in some fluid. So what do you think that does? It means the damn thing moves, doesn't it? And what does it bash against? It bashes against the big solid thing that's meant to protect it. Right? And that's how we lead to concussion. So if we're all made like the woodpeckers, it would be easy. But we're not. There you go, doing something about the woodpecker there. It's probably the only thing you're going to take home today. So go and come and talk to us about concussion and I'll learn about the woodpecker. So I'm going to come back to this slide on a regular basis, okay? Because like I said at the beginning, I'm simple, I like to keep things simple. And ACC in our country actually does some really good things, okay? Some really good things. And they've produced this thing here, which I think is really good for use in the community. No matter if it's not even eventing, if you're watching your child or your grandchild play football or gymnastics or whatever, okay? These things are really, it's very, very good, and just go onto the website and you can find a heap of really good information. And it talks about the 6 R's, so we just want to deal with the 3 R's. You're an official and you just want to deal with the 3 R's. And the 3 R's, you recognise it, okay? You remove them and you refer them to someone else. Right? If you're doing that, then you are doing a fantastic job. Right? You just have to remember those things. Recognise, remove them, and refer them. And this is from your policy statement of Equestrian Sports New Zealand. And these are you. Non-medical personnel have an important role in observing possible concussion and its effects. Right? And should take responsibility for removing the injured athlete from the sport or activity. Recognise, remove, refer. Okay? No one's asking you to be a doctor. No one's asking you to be a nurse. No one's asking you to be some sort of allied health professional. Just be a normal person and use your eyes and your ears. You know, the things we've been gifted and to look after your riders. So recognise, okay, what is it? Well, the mechanism. Okay, if the rider falls off and doesn't land on their feet, you know, you're probably going to start to say they potentially could have hit their head, and that head injury could have caused could lead to a concussion. The rider just doesn't look right. They're acting differently. Okay, they just do unusual behaviours, and if I'm assuming you see riders on a regular basis, and you just think that's just not the typical behaviour. Okay, or listen, what else you got? Listen to the other riders. If someone's concerned that someone's fallen off in the, warming up, and what do you call the warm-up period? Warming. Oh, okay. Look at that. Look at that. Okay. So, learn one thing. Good. This is good. So the warm-up area, and somebody says so and so fell off their horse. Okay. Then I think that's there's a concern there because we know there's a good chance that they're not going to land on their feet. Okay. So listen to the other people around, and remove them. Okay. Remove them for the day. Now, a little bit I know about your sport, that's a difficult thing because it says for the day. And some of your riders have other rides, right? And so that's a difficult thing to do. But if you take it that we are there for rider safety, okay, you are looking after. As soon as you get them off, okay, and you do not let them go back on, you are helping them to recover straight away. all right? And you can issue them a blue card. Now I know this is a new thing, you've possibly heard about it in rugby, which we've been going for a couple of years now, and your organisation has adopted this, and Heidi's going to go and talk about that a little bit later, and we're going to work through what that actually looks like, okay? But a blue card is essentially saying I'm looking after this person because there's enough suspicion in my mind that they have sustained a concussion and I need to start looking after them. And then you refer them for a medical opinion, okay? They need to see someone. Not asking you to be doctors, just asking you to use your eyes and your ears. And again, this is part of the website here, which I think is brilliant. I think it's a really good initiative, and from a whole lot of other sports that I work with, you know, this is a really proactive step by your organisation. I think it's fantastic. I'm biased, yes, I think it's fantastic. So, your eyes, what are you going to see? Right? Well, you've just all described to me before what the drunk person's like, okay? That's what you're going to see. Look, they may lose consciousness and they may lie unresponsive on the ground. Well, that's pretty darn easy. Remember, it's a change or loss of brain function, okay? So the brain's not working, switched off, light switch has gone off, nothing's happening until they come in and recover, okay? Or they're lying motionless on the ground, or they're slower to get up, okay? People who lie on the ground for some time are either they do it to get attention, okay? Or things aren't kind of working right. And I like to take the fact that things aren't actually kind of working right. And so they would be ones I'll be starting to look at a little bit more, okay? Or they just look glazed over, stunned mullet, okay? They just, lights on but nobody's home. You just see it, and you've seen all those people before. Very confused, very disorientated. If they're ataxic, okay, ataxia is when you go to stand up and you fall, all right? Or you start to walk and you walk like you are that drunk person, trying to walk a straight line, and you go all over the place, okay? If that happens, your brain is not functioning properly. There's some parts of it that aren't working, right? Yes, sure, I can get up and walk, but actually I'm not making much sort of logical steps in my mind to be able to take steps to go forward in the right way, okay? So those ones are very much, you know, that is part and parcel of the concussion. If they clutch the head, well, that's kind of easy, and a seizure, well, that's kind of easy as well, okay? I keep coming back to this. If the rider falls, doesn't land on their head, I'm going to have a high index of suspicion, all right? Really high. Or you might be able to see some of these things. I split them up into these different, what I call clusters. Why? Because it helps me dictate prognosis. Prognosis is how long a person's going to take to get better. Okay, so I stick them into these. But you can see there's a whole lot of things, okay? Like we said, mood changes, fatigue is big, right? They just feel more tired than they normally do. They might want to go and have a sleep between rides. Right? It's just not normal behaviour. Do you normally do that? No, I don't normally, but I just feel really tired today. And people will try and put it down to everything else. It's because I haven't hydrated properly, right? It's because I didn't get enough sleep last night. It's because, that was a really tough ride, right? People put it down to everything else, apart from the most obvious thing, okay, after they fall off. So that's why I say, most of the time I protect people against themselves because they make really bad decisions. What? Balance problems, dizziness, lightheadedness, blurred vision or double vision. Okay, I can't see properly or I can see two of everything, really bad things. Or just feeling a little bit confused or disorientated. Slower reaction times, difficult concentrating. They'll be on their phones and it will hurt them, or they'll just kind of, this light on the screen irritates them. So multiple symptoms, right? Again, if I keep coming back to that, they just look and they feel terrible. And one of the questions I often ask, because sometimes it takes me some time to convince people that they're concussed, because some of the rugby players that I deal with, they don't want to know that because it means they have to stand down for some time. So I say to them, did you feel normal afterwards? Yes, sort of. Well, no, it's a yes or a no answer. Did you feel normal? Well, I had a little bit of a headache. Do you normally have a headache in a game? No, I don't. Right. So you weren't normal, okay? So if you just ask them, do they feel normal? Do you feel normal? All right. If people should, if they don't say yes straight away, and they say, oh yeah, I think so, ask them a bit more, okay, because it will reach you. Now there are some people who need to go to hospital, okay, and again, ACC has a little card which is fantastic and has all these red flags on it. Red flags are bad things. So remember I started with the analogy of a house, okay? So the red flags are when I'm taking a photo of your house that there's something wrong with the house, okay? All right? The guttering falling off, the paintwork's falling off, whatever. So the red flags are there's something wrong with the brain that potentially could be a brain bleed, okay? There's some bleeding, there's something we can actually see when we scan people. Now not all the time, but these are the things that they often present with, okay? They get worse. They become more confused, more disorientated, weird type behaviour. If they have a seizure, okay, well they obviously need to go to hospital. If they've been knocked out for, it says 5 minutes, 5 minutes is a really, really, really long time, okay? So for me, if they've been knocked out at all, I'd be sending them off, okay? If they've got prolonged amnesia, they just can't remember things for at least half an hour, then those people need to go somewhere else, okay? You don't want to go home, and I teach all my GP colleagues this, is you don't want to go home and start worrying about that rider. If you're going to go home and worry about that rider, make it someone else's problem, okay? Because you don't want to have your glass of Pinot or whatever it is and start to worry about the rider, okay? And the emergency departments actually do not mind seeing these people, all right? Because that's what they're there for, and they're really good about it. Right? Double vision, a really bad thing as well. Now I've also put on here because, right, something athletes, children, you're very concerned about, you know. If you think they've got a concussion, no, make it someone else's problem. These people need to go to hospital, okay, or need to go to an emergency department. And for maybe the older riders, if they're on blood thinners, it's a really bad, potentially bad thing as well, okay, because of course, with any sort of knock, if anyone is on blood thinners here, it doesn't take much of a knock to get up with a decent bruise, okay? So those people, I think, they're on those things and they've fallen off it, I think they need to be gone and ask the emergency department to look at it. Or they've got a history of a bleeding or a clotting disorder, okay? Then those are the things I'd be thinking of to say, this person's slightly at high risk, right? And they need to go and have this thing here called a CT scan, right? Well, go and sit aside. I'll say that again. Go and sit in the emergency department and ask the doctors there to make the decision whether they need a CT scan. Now, not all of them do, but some of them do. Okay? And repeated vomiting. This is the only one thing I don't like in the ACC in their little booklet. What is repeated vomiting? Could be 2, could be 3, could be 4. It's a different number threshold, don't they, in terms of the vomiting. So, for me, it's adults. You'll have 1 vomit. Okay, more than 1 vomit as an adult, you're going to the emergency department. Children, no vomits. Okay, none at all. You're going to the emergency department. Make it someone else's problem. Get them to sit there. The emergency departments will watch them for 4 hours. Okay, take them 4 hours to be triaged, but they're watching them during that time period. Okay, and why do they sit there for 4 hours? Because surprisingly, if something's going to happen, it's going to happen within generally that first 4 to 6 hours. Okay. So there's kind of method in their madness a little bit. They sit in there, they watch them, and they don't have to do too much, but they kind of are having sort of mastering an activity of a period of observation, if you like. Okay? So these things here, okay, are the things that we need to watch for. And if you're an official and you're at an event, and some of these things are, again, make it something. Now, I put this up here because I said my background is most of my background is in rugby, and so we have these tools, which I'm going to show you are pretty similar, okay? Pretty similar. We're looking for those things that we just talked about before, okay? And then I take them off, I get the ability to take them off the field, okay? And,
and just go back to the other...
Yeah.
Yeah.
What's tonic posturing?
So tonic posturing, yep, is when we fall, okay, we have a reflex in our body, we put out our hands. We want to try and protect ourselves when we're falling, okay? So one, they lose that and they just fall straight down, okay? So there's no protection. And tonic posturing is on the way they're falling down, they're rigid like that. Have you ever seen anyone have a seizure? Yes. Okay, they go all stiff, okay? So that's what happens. That's what tonic posturing is. They have a hurt and they fall down like that, okay? And there's no reflex to protect the head, and they're rigid. It might only be 5 seconds, but it could be less than that. It's very short.
Can I talk about that?
Yep.
The ocular.
Yeah. Oculomotor. So oculomotor is so visual disturbances, blurred vision, double vision, okay, or nystagmus is where their eyes are going bing, 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 looks like a pinball machine, okay, just going back and forth. That's what nystagmus means, okay, swaying to and fro. So any of those signs, like we just said before, are signs they have a concussion until proven otherwise. You don't need to do any tests, okay? You've already done the test yourself because you've used your eyes and your ears, which are fantastic, and you've seen these things, you've heard these things, okay? They have a concussion to prove otherwise. So for me on a rugby field, if I see this, right, it's kind of easy. I don't need to test the player. They've been concussed. Come and sit down on the sideline. And then there's ones which I'm maybe not sure about, didn't really see it, or the mechanism could be enough to make me suspicious. So there's ones that I'm suspicious of. Now in my job in rugby, I have the ability to bring them off, okay? And we can give them some questions, called Maddox questions, and I'll go over that, what maybe that, how that could help you guys, all right? And then I don't even, sometimes I don't even get to the medical room to test them because I've got the luxury of a video, all right? And I can go and have a look at the video and see what happens. In your arena, right, actually people video stuff all the time, okay, on their phones. Right? And so if you've got some of that information, I encourage you to use it, have a look. Get as much information as you can, okay? Because that's what I'm doing in the professional environment for rugby. I'm getting as much information before I even deal with my player, all right, from all the various modalities. And if there's something that looks on the video that doesn't look quite right, and it comes back to maybe there's one of these things there that I haven't seen, but I can see it now when it's slowed down on the video, or when I'm looking on the video, then again, made my diagnosis, I don't have to do anything else. And then, I only put this up because I'm not expecting you to do this, in fact, I really want you to do this, but we then test them, okay? We test them to look at, see how their brain's functioning, and I ask them these symptoms. And those symptoms are exactly what you guys just told me about before, okay? And what I'm looking for them to do in this is to fail it, all right? One of my bugbears as commentators in rugby, they say they passed the head test and they're back on. They didn't pass it, the head test just failed to detect that they had a concussion at that time, okay? Because there's the delayed concussion. What does that mean? It's still there, they just don't show anything for a little while longer, okay? And there's been plenty of players that I've put, actually not plenty, a few players I've put back on the field who, when I go back and reassess them, you know, every time you see there's a breakage and you see people running on the rugby field, you know, I'm not there to give them water, someone else can do that. I'm there to check their brain again, and there'll be people who then develop some symptoms and I've taken them off at that stage, okay? So I want them to fail this, but what I'm trying to get through to you is, yes, we have this in professional, but you can do this and you keep re-evaluating the people, okay? Because sometimes they start to say, actually, I don't feel so well, I've got a headache, and you kind of getting your diagnosis there. And they have to do all this. This is quite difficult, actually.
I'm looking at it thinking I might not pass it.
No, exactly right. You're right. The numbers backwards is always something.
I was just struggling with option 1.
Yeah. So they've got to remember those words.
Oh, okay.
So you tell them those words and they've got to repeat them back to you. And they do it again and repeat it back. Right?
5 words.
5 words. Yeah. And then they have to do it right down the end here, again. So you take them all through this, and then they've got to remember those 5 words again at the bottom here. You know, all the numbers backwards. So it's, you know, you're looking for ways of keeping people from hurting themselves more.
I think we'll start it.
But for you guys, you need that. No, this thing here called the concussion recognition tool number 5 is it's just a little card. It's a pocket card, and it's pretty much got much of the information we've been talking about already. Okay, so it's got some red flags. Okay, it's got some things around the signs we've talked about, some of the symptoms, and this thing called a memory assessment, or what we call Maddox questions. Okay, and how and what we should, a little bit of advice there, but it's a really simple tool that you can keep, you know, print it off maybe. It's all free. You just Google search this and you'll find it. It's free. You just laminate it and stick it in your pouch. So I'm sure there's a lot of administrative paperwork you carry, right? Add it to the pile. If you laminate, you'll have to do it once, so that's a good thing. So if I think about those questions here, okay? Oops, sorry. But, goodness me. If I think about those questions there, this is very much, so we don't ask them, what's the date? Who's the Prime Minister? What year was the World War? You know? They've got to be relevant to, or their address, or their date of birth, because most people, even when they're a bit blur, okay, can remember that. How many times you jumped in a cab, being alcohol impaired, and still can remember your address to get home, okay? So again, the concussed brain will work out what your address and your date of birth generally is, okay? So it's very specific to what's happening. So for me, it would be things like where you're riding today, what's the time roughly now, okay? How did you go on your last event? Where was your last event? What day and month? What just happened? So make it a little bit specific. You just want to test their memory, their brain function that's relevant to the environment that you're in. And there are numerous apps that also can go alongside this concussion recognition tool. Is anything better than the other? No. I think before I hopped on the plane today, I just went to the App Store and put this in, concussion apps, and there's 50, I stopped at 53 actually. I stopped counting at 53. Right, so there is no one gold standard. All it does is providing you exactly the same information we're just talking about here in a different shape or form, okay? If you're going to be using these things, okay, and what I think you should do is to testing your riders, right, because you've got a suspicion. If you've got enough suspicion, never, ever, ever use them to say, no, you're fine, way you go back, okay, because there's enough suspicion in your mind that something's gone on, okay, and I don't think you want to be using any of these tools to so-called clear your rider, okay? Is that simple? So, we kind of know what to look for, right? You're the experts now, right? So you kind of know what to watch for. You kind of know some tools out there that can help you kind of remember that. You kind of know the ones that are really bad, okay? What are the ones I really have to watch out for? These people, I need to make someone else's problem go away, okay? I want to go home and have my glass of whatever and not worry about you. Okay? And why is it important to do this? Okay, this is a rugby slide, I'm sorry. But the earlier you get them off, the better they are, because there's a thing called second impact syndrome. Second impact syndrome in the medical literature was debated for years and years and years. It basically means that if my brain's not functioning and I have a second whack, my brain goes into this metabolic meltdown, okay? Everything shuts down. And when it shuts down, unfortunately, I die, right? Now there's been some cases of this and people said, no, it doesn't really exist. This guy here is a young boy playing rugby in Scotland, had a concussion, witnessed concussion, went to the sideline, was then put back on the field and had a second blow to his head and died, okay? And the coroner in Scotland said he died from second impact syndrome. So whether in medicine, if you believe it or not, it doesn't really matter because medico-legally, it's an entity, okay? But these people are at risk of this happening. Or, if we don't protect them against themselves, they've got a much higher chance of, it used to be called post-concussion syndrome, it's now called persistent concussion symptoms. Just words, but anyway, it just takes them longer to recover. The earlier you get them off their horse, out of the event, and stop trying to do more damage to themselves, the quicker they will get better. Alright? So you're actually helping them. They won't like it, I can guarantee. I've had some players and told me various nice expletives around what they thought of my medical skills. And they potentially could be right, you know, I don't know, but because I've said they're not going back on, right? And I can, 99.9% of them, okay, have come and thanked me afterwards because lo and behold, at the end of the game, they didn't feel right, right? So your riders won't like you, but you're actually doing the right thing and the best thing for them to start. But also, they are much higher risk of sustaining an injury somewhere else. So you put them back on their horse, the brain's not functioning, probably fall off and suddenly they've got a spine fracture or some sort of ankle injury or whatever, okay? So a much higher chance of having other injuries, okay, at the same time. I always put that in, it does make me laugh, because actually there's so many people who do really well, don't they? And they actually have the best game of their life, but supposedly it does make, and I use those for coaches, yes.
Can I just ask a question? Because
Yeah.
a few of us have spoken about this. If we see somebody come off a horse and they obviously have their helmet on
Mm-hmm.
and they have hit their head or whatever, my belief was that you don't take the helmet off until somebody medical is there, because
Correct.
just in case there's a neck injury or whatever.
Good.
So that is the correct thing
Good.
to say?
Yes.
Until, okay, thank
Most
you.
definitely. Because if I think about things, again, simple person, okay, is a concussion going to kill you there and then? No. But if you've got a neck injury, okay, if I move that person and I'm not sure about their neck, could I make them worse? Most definitely, okay? So we always talk about airway first with C-spine control, which means I look after the airway and the person's neck first. Then I look after the breathing, then I look after the circulation, and then I look after their concussion. Okay, that's the way kind of I approach things. It's an order of, yeah. Oops. And then we'll talk about this in my last slide as well, but probably a possible increased risk of long-term problems. People have heard of CTE, seen the film Concussion. Have you seen the film Concussion with Will Smith in it? It's a really good movie, actually. About the problems they're having in the NFL in America, okay, and what repeated concussions can do. And we'll talk about that. But so there's, why is it important? Because you reduce the chance of all of this stuff, okay, all of this stuff. So come back again to my favourite slide, all right. Recognise it, remove them, and refer them to somewhere else. Refer them that day. If they've got those red flags, tell them they've got to go somewhere else and be seen by a medical person at that time. So if I refer them, what should I expect? Okay, what should I expect if I'm sending someone, or I'm seeing someone, I'm sending someone to be assessed by their medical professional? All right. Well, we all talk in medicine about taking history. What does that mean? Just talk to the person. All right? Find out what happened. All right? Generally, if you find out what happens, there's much greater chance of actually making the right diagnosis, because you can work it out, okay, by forces. I teach students about knee injuries. So like when you get tackled through there, well, no need to rocket science to work out my knee's going to go that way, so you're probably into the stuff there. Just think about what the stuff is there. So take a good history and you'll be able to work it out. I look at these things, all right, so I want to know how many concussions you've had in the past, and I want to know how long it took to get better from each of them, all right? And unfortunately, I want to know about this thing here. And why? Because it significantly affects recovery. So past history of depression or anxiety, or current history of depression or anxiety, treated or not. Really. So I'm not saying that every teenage girl who falls off a horse or hits a head is going to take long to recover, but it's one of those things that you kind of do watch out for. And then I'd expect my doctor to do some neurocognitive tests, and I don't know if you've heard of it, we call it a SCAT-5 form, but it's testing the brain function. Much like those tests that I showed you that we do under the stand, it's pretty similar. I expect my doctor, my health professional, if I'm showing up with concussion, listen to me, look at things that may take me long to recover, and actually examine me, right? And not, oh yeah, good. Well, I don't know how many times you used to see that on TV. Yeah, good, all right, the eyes really fine. That's not a test of neurocognitive function. It's making them think about things and try to remember things. You've got to look at their necks, and you've got to do some neurological exams. And this thing here is particularly interesting nowadays, because we know that actually if you fall off something, or you hit your head, then you can disrupt your vestibular system. Has anyone ever had vertigo?
Yes.
Yeah, okay. So there are two types of people when they disturb the vestibular system. One is those people who get acute vertigo. If you've ever had vertigo, it's horrible, absolutely horrible, okay? And then there's a second group of people who disturb their vestibular function, where they just feel lightheaded and dizzy, and you can do some tests and show how their vestibular apparatus, which is in the inner ear, connects with the eyes and connects with the brain. You can show with some simple tests how that's not working properly. And if you identify it, you can rehabilitate it, okay? And if we go back to my previous slide about the increased injury rate, okay, I think a lot of that is probably to do with because of this stuff, right, that we just don't rehabilitate that very well. So that's what I'm expecting, okay? So let's just look at the SCAT form. What is a SCAT form? Well, the SCAT form is, again, it's something you can, it's free, it's downloadable, but I just use it because I think this thing's really good, because it just asks the patient to rate their symptoms. Again, it's a symptom evaluation score, and it's useful when they first come in. For me, you could do it on the, you know, if you're concerned, and you could show the patient, actually, well, you've got this, this, and this, and this, you know, that's not quite normal. So I use it to document how the person's going, how they're getting better. It's got these sort of very simple questions about orientation in it, okay, day of the week, those sorts of things. Everyone forgets the date, but, well, not everyone, most people forget the date. It's got our list of words again, where you've got to remember those 5 words. And it's got a list of those digits that you've got to kind of remember, but you've got to repeat them backwards as well, okay? So it's kind of a little bit. So, but what I'm trying to say is, someone's testing your brain, okay? They're actually doing some formal tests on your brain, just like you would expect if you were a diabetic, to go and, you know, am I hypo, am I hyper, check my HbA1c, check my glucose, all right? Have a formal test. Don't just say, yeah, I feel good. Oh, great, excellent, where you go, all right? And the months of the year in reverse order. Okay, so that forms part of the SCAT form. So again, testing how my brain is working. And then we do a neurological exam, so we test the cranial nerves, the nerves in our brain. And why do I do that? Because the lady down here had that little bleed. What I'm trying to do is pick up those people that actually may have had something going on, because those should be normal. Right? And if they're not normal, it's making me suspicious that they're the people that maybe something else has gone on. I need to take that photo of the house, because the house might not be right. Okay? And there's some balance tests, and if you've ever done these, they're particularly difficult. You've got to stand on 2 feet and close your eyes, and then 1 foot and close your eyes, and then heel with toe closing your eyes. So they're particularly difficult at times. All right. And then what we call delay recall. I go back and I ask them all the words that the list of 5 words, whichever list I've given them. Okay. So there's some formal testing. Okay, and this is what is mandated, the international consensus statement around assessing someone's return to sport after they've had a concussion. And again, I won't spend too much time on this, is the medical stuff, but VOMS is some formal tests looking at the vestibular system, okay? Assessing that and making sure that our eyes and our balance organs and our brain are all working together. Because if it's not, and I get back into my sport, or I get back on my horse, okay? If that's a little bit, and my eyes aren't working properly, and I'm riding and I'm jumping, what's going to do? Well, there's a dysfunction there. It's got a much higher chance of me, lo and behold, falling off again. All right? So back to my favourite slide. Talked about recognise, talked about remove, talked about refer, and what you can expect. So the other 3, I'll work through quickly, because things have changed a little bit in how we manage this, okay? You're going to be involved in this. You may be involved in this. You're not to be left alone, okay? You're going to be in supervised care with a responsible person with a clear set of instructions. So I just have a simple form, but you can send them with the ACC forms. They've got some really simple instructions, okay? And give it to someone who's going to stay with them. Okay? Not to drive. Now, I mean, a lot of your riders, that means they've driven to an event, okay, and now they've got to drive all the way home again, but they're concussed, or you suspect they're concussed, and you've issued them a blue card. Well, we're going to have to sort that part out, okay, because they have an accident, the insurance company's not going to protect them, because you already issued them a blue card, so there's a trail, okay, and 2, from a legal perspective as well. All right? So people might be really combative around this, really combative. And so I think the simple way out of it is, actually, I'm not making the decision, it's the law. Okay? Just defer it to someone else. It's the law. No alcohol. Right? No alcohol is really better. And not to use recreational other drugs. Paracetamol is okay. Right? So paracetamol, Panadol for a headache is an okay thing. You're not going to mask something. People who get worse, right? Despite taking paracetamol, the headache will get worse and worse and worse and worse. It won't mask them. And 4 to 6 hours is generally our critical period. All right? So if you do have something where, unfortunately, you do have a little bleed in the brain, then the body will compensate for a while, and then it will start to decompensate, and we'll get all those symptoms coming out. So that's you're going to have probably a part to play in that, which is great. And then I want to talk quickly around this. Where do I fit? You get three types of people. You get those people who've got some symptoms, those people who are green, they're good to go. Some people bounce back really quickly, okay? And then there's these people in the middle which I'm really interested in. If you're asymptomatic, okay, what happens? Well, really big on this is use your brain to get an education or stay in your job generally, okay? Most people aren't going to get paid for riding their horses, right? There's a few at the top, I get that, and some of these younger riders, they may get to that, and that's fantastic if they do, right? But I'd say as a betting person, right, the chances are slim. And so you need your brain to get an education, you need your brain to stay and work. And for me, if you don't want me, if you're in Auckland, I'm more than happy to see any of your equestrian riders, but don't send them to me, okay, if you don't want me telling them this, because I'm going to tell them they can't ride until they're back into school and functioning full time, okay? Black and white. Why? Because they need their brain to get an education, their brain to get a good job, etc., okay? And then they're going to do some exercise, and then they're going to come back to sport, and we'll work through that, versus those ones that are still symptomatic, and we're going to take them a little bit slower. 70% of people, adults, will get better within 2 weeks. Remember I said it's a transient disease, transient illness, injury I should say, sorry. So 70% of people will get better if they do the right things, and you're going to help in that because you're going to recognise them and you're going to stop them hurting themselves by giving them the blue card. All right? Whereas kids are 13 years age, that's kind of the definition, 13 and under, they take about 4 weeks. Why? Because their brains are still developing it. But 70% of people get better within 4 weeks, right? If they just do the right things. And it's really important to tell people that, right? To get them to buy in that actually they can control this. Right? Now, take walks in your sport. This is from your website. Take this part out, okay? Because your guidelines say, this is the lady with the blue card, okay? Your guidelines say, for the first 1 or 2 days, I would expect rest and no activity, you know, just mentally and physically recover, right? That's what everyone does, no matter what sport it is. Those people who still have symptoms can do some light aerobic exercise. If you're thinking you're fine, then I'll be starting some light aerobic exercise, and then I'll be doing this graduated return to riding program, all right? So you rest them to start with, you get them to do a little bit of exercise, okay? They could just be walking or jogging or some simple things, right? And in rugby it's mandated how many days depending on your age. Equestrian Sport New Zealand haven't mandated that, and that's perfectly fine because there is no hard and fast evidence that says there's a definite time. Right? We defer to, you've probably heard the rugby says 3 weeks. It's just an anecdotal bit made up, okay? 3 weeks because we know 70% of people get better in 2 weeks, so we're just making a date that is picking up the majority of people, okay? And for kids it's slightly longer. And then a graduated return. So what I would expect is a little bit, just a short period of rest, okay? And then make sure that your brain's okay by just doing some light exercise, all right? Before they jump back onto their horse, okay? And remember, if it's your son, daughter, whomever, friend, you've got to be back into work. Because if you're not back into work, or you're not back into school because your brain's not working properly, right? And you get back on your horse and you have fall, well, what's he going to do? It's just going to compound things, okay? And what does your return to riding look like? Well, this is what it looks like, okay? We'll try to make it sort of as specific as we can for your sport. The key here, right, is it's a light aerobic exercise, but get back and doing horse cares. Now, I don't know anything about this, okay? So I've never fed a horse, I've never groomed a horse, and I had to sit with some people to help me with this, okay? All right? So you could, and I tell people that actually, especially mums who bring maybe their daughters or sons to me, that they don't have to mollycoddle. Let them do chores, let them clear the room, let them do the dishes. It's okay, right? Despite them having a concussion, it's okay, right? So my understanding is from the people I've talked to that your riders have a huge affinity and bond to their animals, and so getting them back in touch with their animals, okay, even though it might be riding, is a really good thing, okay? So you don't have to say you can't do anything. And then what I'd like them to do is sort of some plyometric back bounding activity where they're jumping up and down where they're moving, and so their neck is moving, and they're trying to replicate, I guess, some of the time they're going to be spending in the saddle and not have any symptoms. Right? So adding some movement into that. And then going with some lower impact drills. Okay? So again, I had to get help on this. Right? You'll understand this way more than I will. Walking, trotting and hacking, apparently that's low risk, okay? Is that right? Am I right on that? Yeah. So we're going with the lower impact, okay? With your helmet on, okay? With your helmet on. And then we're going to some more higher impact. So what you're trying to do, right, the key here is having a period of rest, doing some exercise and making sure you don't feel worse, right? Then getting back into some exercise which may replicate the type of movements that's going to happen. And if we're still feeling fine, then get back onto the horse and do some low risk type riding. And then if we're still feeling fine, then go into some high risk riding. Okay? It's just a great, and you can't go from here to here. Right? And why? It's because some people will fail. And when do they fail? They'll feel not so good. What we're trying to do is load the brain up, okay? So first of all, the heart rate getting up, then adding movement, and then adding the skill set they have to think about. Right? And you're trying to reproduce their symptoms and make sure they don't get their symptoms back. Because if they do get their symptoms back, their brain's not ready to go to the next level. All right? So it's a structured process. And I'm happy that people move through that every 24 hours, but you can only move through that, right, if you pass this one and you feel completely normal, right, before you go to the next one. So that's why I think it's individualised. I think you can do it in 6 days or whatever, okay? But you've got to listen to the symptoms. And if I come back to the beginning, it's protecting the person against themselves, right? Getting that buy-in. That really, really need them to help us out here because they're the one that's their brain. So that's if you're in that green line, okay? You're green, good to go. Way to go. This is the program you're going to follow, or this is a process that I expect people to follow. But if you've still got symptoms, right, that's okay. It just means your concussion's still there. Again, the same sort of things we've talked about, right? And I put this, because I love this, that Goldilocks was really clever, okay? She was really clever when it comes to concussion because that bowl was too much or too hot, and that bowl was too little too cold, but the bowl in the middle was just right, okay? And that's what Goldilocks ate. So my analogy here is actually so you've got symptoms, all right? You're allowed to have symptoms because you've had an injury, just like I've got an ankle sprain, my ankle sore. It's part of the injury. But if I do too much, right, it'll make me feel worse, okay? So my symptoms will be way up here, I'll feel worse. But if I do nothing, well, I won't feel worse, but both of those things there, if I do those things, will take me much longer to recover, all right? So doing nothing is not an option. Doing too much also is not an option. It's got to be guided, okay? And I talk to people a lot about operating at the bottom of the U-shaped curve where you monitor your symptoms, and so long as you're doing things that aren't making you feel worse, then you're doing okay, all right? And I talk about a +3 factor. I rate them out of 10. Just take from that actually doing nothing's not a good thing. And getting back and trying to do everything is not a good thing because it'll make you feel worse. But getting people to do some stuff and making sure that it doesn't make them worse symptomatically is a really good thing. All right? And relative mental rest, which means your youngsters, right, these things are no-go. Right? You need your brain to get an education. Your brain has, when it's concussed, right, it uses up energy. You use up energy, you get tired, all right? And so it's like the battery on their phones, it drains really quickly. Now, if your battery's going to drain really quickly, use your brain for what you really need to do it, use it for. Be at work, doing your job, okay? Being at school, getting an education. None of these things help with that unless you're doing maybe some research or some emails or something's related to a school assignment, okay? You're allowed to be on these things. Otherwise, I know that children nowadays are born with the right? You used to see the head first, now I think you see the hand with the electronic in it. Right? And prizing it off is not a good thing, not an easy thing to do. But if you can do it, you are helping them to get better, right? Because they'll spend forever on these things. So get them off these devices, right? Use the brain for what they need to use it for, and monitor the symptoms, and lo and behold, they will get better. Light aerobic exercise, like we've talked about, okay? Caring for their horses is an okay thing. there should be another, hopefully. So we're dealing with these people here, okay? So we talked about these people, we're just going to progress and we're talking about these people here, about what we do. They've still got some symptoms, get them to do things, okay? And this, right? This is to remind me to tell you that the biggest problem I have seeing in my concussion, okay, right, with riders is keeping 2 feet on the ground, right? Because they never want to keep 2 feet on the ground. So I let them do things, anything they want to do with their horses, but 2 feet have to stay on the ground. Okay? All right? So if you can take the 2 feet out of there, just remember that. And I'm quite specific about it because they go from this to this to this to, oh, yeah, it must mean I can do the next part too. Okay? So 2 feet have to be on the ground. And if they're not getting better after about, remember I said 14 days, 70% of people get better. Okay, this is the group that I'm really interested in. This, and this is not a promotional thing for me at all, but I just, nowadays, there are things we can do with this group of people. Don't let them sit around. If you've got a friend, you've got a rider, you see someone the following week and they're still having some symptoms, okay, then educate them and say, actually, there are things we can do. And we use treadmill testing, right? We would treadmill test people really early at day 14, okay? And in fact, the studies overseas in the US would treadmill pediatrics, so kids, within the first week, okay? And why? Is because exercise is a really good thing. So now you're experts, okay? Aren't you? Actually, you're probably more educated than a lot of practitioners out there, okay? In terms of just understanding what to look for, what's bad, what do I need to be concerned about, what do I need to send off, what do I do for these people, okay? What about prevention? Is this thing a good thing?
Well, it
Yes,
is.
yes.
It is. It has a previous accident.
Sure. If it's if you fall off and it's compromised in some from its functional capacity, then get a new one. Unfortunately, okay. Don't rely on the old one. These things are good things. They prevent, skull fractures. All right. Will they prevent concussion? No, unfortunately not. Dead right. Well done. Well done. They don't, but it's a really good thing. Okay. And I guess in your events that are mandatory. Some of the people I've seen who have been recreational riders or just riding at home without helmets on. It's just like, it just makes no sense to me. Every time you jump on a horse, stick a helmet on. So it's kind of getting that message out. And it does. Look, it reduces, TBI is traumatic brain injury, it does reduce, okay, those really bad structural things that we see. Taking the photo of the house, there's something wrong with the house, okay? These things are good things for that. Mouth guards. Anyone wear mouth guards? Now, a lot of things happen in life or medicine because we did this, so we always continue to do it, right? Or we didn't do this, so we always continue not to do it. What's the reason for not wearing a mouth guard? Anyone? I don't know. I don't know the answer. Because they look ugly? There's some honesty. Yeah, look ugly. People will say they can't breathe properly, they can't talk properly.
At the moment, I don't think there's been any trends to wear them, no equestrian, but I know the racing industry had a big conference in Asia earlier in the year.
Yep.
And some research has come out to say that they will dramatically protect. So I think New Zealand thoroughbred racing are looking at it.
So as parents, if you want to reduce the visits to the dentist to get the teeth repaired, they'll do that. They'll actually reduce the chance of jaw fractures. Okay? And in contact sport, and I think people falling off a horse is probably a contact sport, okay, there is some evidence to say they may protect against concussion. There's some older evidence to say they won't, okay? So what we call equivocal. Some say yes, some say no. For me, it doesn't do any harm, right? There's no harm in doing it, apart from nobody's ever done it and it might look funny, right? And that's a social thing, right? And maybe we need to start challenging that, okay? And saying, look, we know there's a risk here, and I want my rider to have as much protection as they can. Prevention, I guess, just hammering home to do as much as we can. These things, I think, every time you get on the horse, whether you're in a competition or not, you know, just need to camo, you need to put that on. And like I say, those, I'm interested about the social stuff about it. Right. And this is from ESNZ website as well. All right. So you guys are always, you're a step ahead already because you're actually here, right, and taking an interest, which I think is fantastic. And so you are going to raise the awareness, okay? And you are going to go, actually, I said before, early removal, early recovery. And I kept this slide in because everybody wants to know about this. All right? Everybody. It's the one thing I get asked the whole time. So what are the long-term risks? Okay. In the NFL, they did big studies, big brain studies, okay? And these people were shown to have an abnormal looking brain. It looked like a form of dementia, they just had a different protein, but essentially like an Alzheimer's type picture, but with a different protein, okay? And so they got really concerned, well they didn't actually until the guy, actually the African guy, pointed it out to them because they tried to sweep it under the carpet for a while and said, listen, there's something going on here. We've got all these players who've got this problem, okay? And they're called neurodegenerative conditions, Alzheimer-like conditions, cognitive ability to think, ability to function on a day-to-day basis, and obviously mood disturbances in terms of depression, okay? And there's a big, you know, it's kind of like, oh my God, everyone with the concussion is going to have this problem. The more we've gone on, we've more realised actually there's probably not a cause and effect, okay, but there is an association. So what does that mean? It means if I get hit today and have a concussion, am I going to develop this, right? Possibly not, probably not actually, not possibly, probably not. What is going to determine if I develop this is probably my genetics more than anything else, right? If there's a family history of dementia or I've got alcohol or substance abuse or something else going on, right, that may then lead to this. However, if I have repetitive events, and if I have repetitive events in which I do not report or in which I am encouraged to continue participation despite still being symptomatic, could this happen? Yes, it could happen. Right? And I think that pendulum has moved a long way. I'm hoping it has moved a long way from that blind, disregard for anything and harden up and get back out there in terms of, I know from a rugby perspective, to a much more informed population, and it requires people like yourselves, okay, who are out there witnessing, seeing incidents happening, starting to put people down the right path and getting them protected. Right? That hopefully, I don't think we'll see lots and lots and lots of this, but wait and see. And if we all do the right things, we know.